Afternoon everyone. We are live today from Sakra World Hospital, Bangalore. Here we have with us our expert Dr. Jhansi Lakshmi Peddi, a consultant of OBG and gynecology to discuss all your queries on fertility enhancing surgeries. Good afternoon, ma'am.
Good afternoon.
Welcome to our live program. Doctor, here are a few questions from our followers on fertility enhancing surgeries. So let's start now.
Yeah.
What do you mean by fertility enhancing surgeries?
Any couple who are trying to conceive and are not able to conceive after 1 year of unprotected sexual activity or are suffering with recurrent miscarriages has to be evaluated. And in these patients, the surgeries which help in diagnosing and then treating the cause of this infertility, these surgeries play a very important role. Due to these surgeries, the chances of conception are increased and also the recurrent miscarriage rates are decreased, thereby increasing the chances of having a healthy pregnancy. These surgeries are called as fertility enhancing surgeries.
Okay, my next question is, how can surgery enhance female fertility?
Sometimes what happens is, even despite of doing lot of blood tests, ultrasound, MRI, even CT scan abdomen, the cause of the infertility is not identified. And even if it is identified, it may not be treated with the medicines. So in these patients, these surgeries help in identifying the cause and also treating that cause. Thereby, they increase the chance of fertility, and also sometimes what happens, the relation between the reproductive organs, that is the uterus, ovaries and the fallopian tubes, gets altered. So these surgeries help in restoring the relationship among these reproductive organs to almost near normal status. Thereby they enhance the chances of fertility.
Okay. How are these surgeries are different from other gynecological surgeries?
Normally, any surgeries are done mainly to remove the diseased organ or a part of that diseased organ. These surgeries, in spite of doing this process, that is removing the diseased organ or the part of the diseased organ, they also focus on certain ailments of the surgeries. That is, the main concentration is given so that the blood supply of the reproductive organs is not compromised. Also, there is minimal damage to these reproductive organs because of minimal handling of the ovaries and the tubes during the surgeries. This way, the damage to the organs is reduced because of minimal handling. Also, again, as I said, they restore the normal anatomy of the reproductive organs to near normal status, thereby enhance the chances of fertility. And these surgeries are minimally invasive. Minimally invasive in the sense there is a smaller incision, less blood loss, then because of minimal handling of tissues, less adhesion formations, less scarring. Finally, the less hospital stay and faster recovery in these patients.
Okay. What are the conditions that are treated by these surgeries?
See, due to the advancement in the medical sciences, nowadays most of the causes can be identified and treated with these surgeries that are leading to the infertility. The most common causes that can be treated include PCOD, ovarian cyst, endometriosis, tubal blockage, hydrosalpinx, fibroids, focal adenomyosis, then some submucosal fibroids, polyps, septum in the uterus, and the adhesions that are inside or outside the uterus that are causing infertility.
What are the types of fertility enhancing surgeries?
Mainly there are two modalities by which the fertility enhancing surgeries are done. One is laproscopy and the other is hysteroscopy.
How is laproscopy done?
Laproscopy is a surgical procedure, though it's a minimally invasive, it's a surgical procedure whereby a thin narrow tube is passed through the abdomen of the patient, and inside the abdominal cavity is seen to diagnose what is causing infertility, and if any cause is identified, it is also treated through that small incisions only.
Okay. Which conditions are treated by laproscopy?
The conditions which are treated by laparoscopy include ovarian cysts, endometriosis, PCOD, fibroids, adenomyosis, tubal blockages, hydrosalpinx, and adhesions that are distorting the normal anatomy of the reproductive organs.
Doctor, what is hysteroscopy?
Hysteroscopy is again a very versatile modality and that is helping infertility specialists to identify the diseases that are obliterating the uterine cavity. That means it's a procedure in which a very thin scope, or you can say a thin tube, is passed through the cervix into uterus, and the inside of the uterus is seen, and if any disease is found out inside the uterus, it is treated then and there.
What conditions are treated by hysteroscopy?
The conditions that are treated by hysteroscope include polyps, submucosal fibroids, septum inside the uterus or septum near the outlet of the uterus, then certain procedures that lead to adhesion formations in the uterus can also be removed by this hysteroscopy.
Does PCOD patients require surgery?
Normally, PCOD patients don't require surgery, but some PCOD patients who are resistant to the ovulation induction drugs or in whom there is high chance of ovarian hyperstimulation during IVF do benefit from these surgeries.
Which fibroids will require fertility enhancing surgeries?
See, fibroids are increasing nowadays, and it's not that any particular age is only patients of particular age are having the fibroids. It's very common in reproductive age group also, but all fibroids will not require surgery. Certain fibroids that require surgery include very large fibroids, especially the intramural fibroids and the submucosal fibroids that are having an impact on the endometrial cavity of the uterus. These fibroids will require surgery.
Does removal of ovarian cyst means loss of ovary?
No, it's only a myth. Because of the advancement in the technologies and expertise of the doctors, the ovarian cyst alone is removed, preserving the normal ovarian tissue to the maximum extent. So only the diseased part, which is not useful and which is causing the problem, is only removed.
Okay. How these surgeries help endometriosis patients?
See, endometriosis is a very debilitating condition nowadays. The main cause of infertility because of endometriosis is one thing is there is a formation of ovarian cyst, and the other thing is there are formation of adhesions that are leading to the abnormal anatomy of the reproductive organs, that is the ovaries and tubes, they get stuck behind the uterus. Thereby the communication between the tubes and ovaries is altered. So due to the fertility enhancing surgeries, this communication is further re-established. Then the cyst that is causing deleterious effect on the oocytes because of its chocolate material and all is also removed, that is the diseased part of the ovary is removed and the normal part of the ovary is restored in these patients. So these surgeries play a very vital role in these patients.
How these surgeries help in restoring normal endometrium?
See, as I said, hysteroscopy has a very important role here. So when we put a scope inside the uterus and we see that there are certain polyps or certain fibroids that are in the endometrial cavity. So what happens when these things are there? They hinder with the implantation process because the embryo that is formed has to come and get attached in the endometrium. And when there are polyps or fibroids, they are causing obstruction for the embryo to get implanted. So with an operative hysteroscopy, these polyps and these fibroids are removed, thereby restoring the endometrial cavity and giving the chance for the embryo to come and get implanted.
My last question is, what is recovery time for these patients after surgery, and how early after surgery can they start trying for pregnancy?
After, as I said, these are minimally invasive surgeries. So immediately after the surgery, patient will be kept in observation for 2 to 4 hours. Most of the patients, they get discharged on the same day or at the maximum next day. So the recovery is very fast. They can start their day-to-day activities from the next day onwards. Some patients are advised to avoid strenuous activities for about a week. After that, everything comes to normal. And most of the surgeries, these patients who undergo, they can start trying for the pregnancy immediately after they get their next periods, except for the fibroids, because myomectomy involves a scar over the uterus, so uterus has to heal properly can start conceiving. So in these patients, we advise them not to conceive for at least 4 to 6 months, and after that they can start trying for the pregnancy. Apart from the myomectomy, other all surgeries, they can directly start trying for the pregnancy from the next month onwards.
Okay. So with this, we come to today's live show. Thank you, doctor, for your valuable inputs. Thank you, viewers, for joining us. If you have any queries, you can join with us. Our expert will answer them for you. Thank you. Thank you, doctor.